So the different kinds of therapy are going to be individual counseling. That simply means it's just one person coming in and they are just attending sessions alone and working on whatever's going on with them. There is couples or marriage therapy, and that is simply, people that are in a relationship. You don't have to legally be married in order to do that. One issue there is that not all insurances cover couples counseling. Generally, we just have to call and check that specifically because it can sometimes not be covered. But you do not have to legally be married, and only one of you has to have insurance. So if there's two people and they're just dating and they want to come in for any kind of counseling, whoever has insurance that we want to use is considered the client. And then, so that's billing wise, that's what we would need. But you both don't have to have the same insurance. We can figure out which one's better to use or cheaper on our end. So then there's another thing called family therapy. That can look a lot of different ways. It could be a mom and a kid coming in. It could be both parents and two kids. Whatever the family dynamic, maybe it's grandparents raising kids, whatever that family dynamic is, that's the family setup. So oftentimes in our office, we like to start with individual therapy. We think it's a good idea to kind of get everyone in and started with counselors and work through what's going on individually. And then we'll start maybe couples or family counseling. It just seems a little bit easier that way. It's kind of a natural progression instead of coming in automatically. If you have a family member of five family members coming in, jumping right into family therapy is overwhelming and really, really difficult to do that. So we generally will encourage everyone to start with individual. We will assign everyone their own counselor. And then when it's time to progress to couples or family therapy, then we will switch them all to a totally new counselor. So that last counselor is going to be a neutral party who doesn't know anybody, and nobody feels like they're on their side. So that's a really cool thing with having 8 therapists in our office, that we are able to do that and to make sure that everyone has the integrity of having their own therapist and also getting whatever services they need, individual, family, couples, whatever that might be. So there's also what's called group therapy. We don't offer this in our office. There's really not many of these in Lubbock at all. A group therapy is essentially going to be a group with a lot of common factors. So it might be a teenage group that focuses on depression, or an adult group focusing on grief, something like that. For some reason, there's just not a lot in Lubbock. I think primarily in private practice we do the first ones I mentioned.